Minority community leaders want to make sure the distribution process in Oregon is equitable. This as people of color have been disproportionately impacted by the virus. And KEZI 9 News reporter Evita Garza shows us how elected leaders are addressing people's concerns about the COVID-19 vaccine, getting to those who need it the most.
Marginalized communities are left out of the civic engagement process and discussion.
In the new year, elected and public health officials are making sure the COVID-19 vaccine is distributed equally, especially among people of color.
Communities without power and clout.
Recently, leaders of minority advocacy groups met to discuss this very issue. Oregon Health Authority Director Patrick Allen said they originally had an initiative to better reach underdeserved communities. Then he said the pandemic hit.
A foundational reimagining of how we do almost everything as an agency.
Statistically, BIPOC, Black, Indigenous people of color have less access to healthcare and testing. Since the pandemic hit, advocacy groups from all over the state have worked with county health departments for months to create specific outreach in many languages. They've received millions in CARES Act funding to be the trusted buffer between marginalized groups and the government to share information and testing. Allen said more than 3 million people have to be vaccinated for COVID in order to go back to normal. And in order to bridge that gap, he says culturally specific outreach needs to continue in order to get everyone tested, especially people in minority groups. In Eugene, Evita Garza, KEZI 9 News.